my name is Dr. Sandy Baird. I am the owner of Riverstone Chiropractic here in Oakland, California. We're going to be talking today about Achilles tendonitis. So this is a condition characterized by pain and stiffness in the Achilles tendon first thing in the morning. Sometimes there's a lot of pain the next day after exercising, and there's pain in the back of the leg as your activity increases throughout the day. You might also notice that there's a bump or a thickening occurring along the Achilles tendon. There are two types of Achilles tendonitis. The first is insertional tendonitis, and the second is non-insertional tendonitis. So the difference is in the insertional tendonitis, the actual insertion of the Achilles where it comes down and crosses into the heel, that becomes inflamed and painful. And with non-insertional tendonitis, there's an area that's not quite all the way down on the heel, it's right where your calf meets your heel that has the problem. So these are both conditions of the Achilles tendon. However, non-insertional tendonitis tends to happen more in young, active people, and insertional tendonitis can happen with anyone, whether they're active or not. Other than an acute injury, there's a few other causes of Achilles tendonitis. There's doing too much too soon. So for runners, that might mean that you've increased your mileage too much or too fast, and your body just cannot handle the extra load. Another thing would be that your calves are just really tight, and sometimes even other muscles higher up the chain, like hamstrings and some of the glute muscles, the tightness there can affect all the way down the chain into the Achilles. And then sometimes there can be a bone spur that is causing the tightness. Usually it works the other way around. Usually the tightness causes the tendon to pull on the bone, and so the force on the bone, I think it's actually called Wolff's Law, force on a bone causes bone to remodel. So that actually causes the bone spur to happen, but sometimes it can be the other way in terms of which came first, the chicken or the egg problem. There's one important thing to know about Achilles tendonitis, and that is it's not always a tendonitis. So if you look at the end of the word for tendonitis, it's itis, right? So itis means inflammation, but there's not always inflammation involved. There's another word, a new term that's coming up, and that more and more this condition is getting named as it's called Achilles Tendinosis. So if you look at the end of the word OSIS, it doesn't mean inflammation, right? It basically means a degenerative response. And that's exactly what it is. If you would look under a microscope, you would see that individual fibers of the Achilles tendon have actually become degenerated. With this degenerated response, adhesions are actually laid down within the tendon, and those adhesions are the cause of a lot of pain, and they actually restrict motion. A third thing that they do is they impact your proprioception. So your body's sense of where you are in 3D space, that's actually thrown off if you have an injury to a tendon. So what needs to happen if there's adhesions in a muscle? Well, ice is not going to help. Ice is not going to make an adhesion go away. Ice might give you a little bit of pain relief, but it's not going to address the adhesion. Other things are stretching. You're going to get some benefit from the stretching, but you're not actually going to get rid of the adhesion. So it's like if there's a knot in the middle of a rope, if it's just a regular rope and you pull on the two ends, you're going to get some stretch out of it. But if there's a knot in the middle, yeah, you might get a little overall stretch, but you're just tightening up the knot in the middle, and that knot in the middle, that's the adhesion. Other solutions like anti-inflammatories, again, those are not going to actually reduce the adhesion. In order to reduce the adhesion, you need to do a physical technique. It's non-invasive, it's not surgery, but you do need to get in there and manually break up the adhesion. My treatment approach of choice is called active release techniques. It works to break down the adhesion by using patient motion. So to take an example, we're going to be working on the gastrocnemius and the soleus muscles. Those are the muscles that go along the back of the calf. And what's going to need to happen is that the muscle is going to need to be put in a shortened position. And then I take a thumb or a hand contact on the adhesion. I maintain that contact while the body part is lengthened out. So this will put the gastrocnemius on a stretch. The adhesion is pinned down. The motion causes the fibers, the adhesions, to break up. So that's one part of the puzzle, is addressing the gastroc and the soleus. There's usually a little bit more to it. There's usually a reason why the calf muscles are so tight on one side. Most people have two legs, and most people only come in with Achilles tendonitis on one side. So what's going on with that? Oftentimes there's either a weakness in the hip or the glute, or there's adhesions in some of the glute muscles. And what happens when there's adhesions in the glute, that actually throws off the biomechanics down the chain. So by the time you get to the foot and the ankle and the Achilles tendon, there's problems. To fully treat Achilles tendonitis or tendinosis, your chiropractor will check all the muscles and all the joints in the area and check and see what needs to be adjusted, what needs to have soft tissue work done, what needs to be rehabilitated. Is there something that's strong? Is there something that's not stable? They'll look at the whole picture and put together a plan and get you back to the activities that you want to be doing. So that's an introduction to Achilles tendonitis and Achilles tendinosis. If you have any questions, please give us a call, 510-465-2342, or check us out on our webpage, riverstonechiropractic.com. Thank you for watching.